Hello, Dr. Pooyan here. There is recently significant debates regarding what's the best treatment for volume loss in face, dermal filler versus fat transplant. Especially these days, hyaluronic acid dermal fillers are under attack by plastic surgeons who have conflict of interest in the market. That they might last too long, they cause swelling, or they might migrate. However, there are a few factors you should consider before choosing your treatment. Hyaluronic acid dermal fillers are the same protein hyaluronic acid that we have in our skin is responsible for hydration and volume and collagen production in our skin. That's why the chance of reaction is very minimal. The results are very predictable because we have very good control on it, and pretty much the results we get is what we see, and they're reversible. If you do not like your results or there's side effects, we can dissolve them with hyaluronic. And what's the solution for the surgeons that say hyaluronic acid is dangerous? It's fat transplant. However, fat transplant can have more side effects and risk. One is that the fat that we have in our face is a yellow fat that is responsible for volume and the shape in the face, and is totally different from the brown fat that is harvested from the abdomen, buttocks, and thighs and is transplanted to the face. The brown fat is usually a rougher, thicker consistency fat, and that might result to an uneven or rough look in the face. That's why we never get cellulites in our face, but we may get cellulites in the thighs, in the buttocks, because the fat there has a different consistency and the visual difference is there. The other problem is that it's a live cell fat transplant. That means that those live fat cells may actually not survive, all of them there in some areas, or some of them may proliferate and increases volume. That causes a risk of asymmetry or uneven results. And if you do not like your results, there's no way that you can dissolve them or reverse them, unlike hyaluronic acid fillers. In addition, you should consider that fat transplant usually is promoted as a very long-lasting treatment. However, you should be cautious that sometimes it might last too long. If you do not like your results or have an overfilled look, it might last 15 years or longer, unlike hyaluronic acid, which is usually gradually dissolved by our own hyaluronidase in our body. One other problem of fat transplant is the overfilled look. Many of the overfilled looks that patients are afraid of are actually not because of dermal fillers, they're because of fat transplant. And the reason behind it is that the surgeons have access to significant amount of fat that they can harvest easily and freely from the patient's body, and that makes them tend to overfill the face of the patients. That's unlike hyaluronic acid fillers that they come in a pre-measured and pre-filled syringes, and we also see the results as we inject, and prevents us from having the overfilled look. The other factor that might contribute to overfilled look after fat transplant is that, again, these are live fat cells that are transplanted there, and especially when they mix them with PRP, they might proliferate to more fat cells, and that will contribute to more overfilled look. These are the factors you should research about and consider before deciding for your treatment option. In my opinion, which is also backed by science, HA dermal fillers are very safe and effective if are done by experts.